Freestanding emergency centers, a real solution for access to care in Texas. Until recently, the state of Texas has gotten a big fat F for access to medical care. There are only so many hospitals across the state serving the entire human population of Texas. So when you or a member of your family gets hurt or sick, traditionally, what options have you had? That's right, you went to the closest overcrowded hospital ER you could find, only to wait hours and hours in the waiting room for emergency care. That's now all changing. Enter the Freestanding Emergency Center. Freestanding ERs are emergency centers which are not connected to a hospital, and there are now more than 320 of them in Texas alone. Freestanding ERs are not clinics, and they are not urgent care facilities. They are true emergency centers open 24/7, 365 days per year, providing state-of-the-art emergency care for you and your family. Freestanding ERs treat everything from lacerations and broken bones to heart attacks, stroke, and a broad range of trauma, using the same diagnostic equipment, CT scans, ultrasound, EKG, X-ray found in hospital ERs. And guess what? Freestanding ERs are staffed by experienced emergency physicians, just like your local hospital. Freestanding ERs get patients in faster and treat them more efficiently than hospital-based ERs, and generally at a lower cost. And if you must be admitted for hospital care, generally speaking, a freestanding ER will transfer you to a local hospital, completely bypassing the crowded hospital ER, delivering you directly to a hospital bed. In 2015, the freestanding ER industry provided jobs for over 10,000 Texans in urban and rural communities across the state, while treating many thousands of satisfied patients. The bottom line? Freestanding ERs are making access to care more accessible, giving patients options for emergency care, while helping decongest hospital-based emergency departments across the state of Texas. Patients are happy not to be treated like cattle anymore, and they are happy to have a choice as to where they seek care. They are tired of waiting hours to be treated. Now that wait is over. Who's not happy? Major health insurance companies, that's who. Believe it or not, they like the current system with all its inefficiencies. Health insurers know that the more difficult it is for you to get the care you need, the less they must pay out. You now have a choice in where you go for emergency medical care. Take a moment to write your local senator or congressional representative and tell them you want better access to care and support freestanding emergency centers in your community. Hopefully, you'll never need a freestanding ER, but it's nice to have one around the corner if you ever do.